My pitch comes from something I observed in the clinic.
I consider myself an international disability advocate because I have 2 disabled sons.
We know 15% of our hospital readmissions are due to medication errors. This in turn solves as a major pain point for our home health care practitioners.
I'm a patient because I am a family member.
Treatment of a disease may be entirely impersonal, but the care of a patient has to be completely personal.
My mother has lupus and she's had it for the past 15 years. I am the person responsible for her health and well-being.
The problem I'm proposing to help fix is how to get patients more mobile in a safe way to get them healthier and out of the hospital.
Is there a way that we can use technology to make my life easier and simpler so I can be a better provider for her?
A healthcare hackathon is an amazing way to really inspire change in both patient experience and provider engagement in one weekend.
From my perspective, it is a source of a lot of new ideas and ways of looking at systemic problems in the healthcare industry.
I love organizing healthcare hackathons because it's a chance to do community building and really challenge the status quo about what we can do in terms of healthcare innovation.
My first hackathon was the Hacking Pediatrics Hackathon, and my biggest takeaway from that was the great sense of teamwork that came out of working with people that you've never met before.
I participated in last year's Healthcare Hackathon at Yale, where I was able to form a multidisciplinary team and actually take an abstract idea and form a product in the course of a weekend.
I came to Yale from about a decade being an Air Force Special Operations pilot, and what I really like is an environment of controlled chaos that you have to somehow kind of manage. In a period of 24 to 48 hours, you see people do things that would take others several months or years to accomplish. That's a remarkable thing.
The best ideas always come when you have limited time to work on them, because your brain just shuts off all those judgment things that go on normally, and ideas just flow out. You don't have enough time to critique or highly critique ideas or problems. You just throw out ideas and let them stick, and sometimes the most genius ideas come out in those impromptu sessions.
It's a really good opportunity to uncover the problems that really exist in the healthcare field that you might not originally think do exist. And it gives you the setting along with the connections in order to innovate upon them and actually find real solutions.
Going to hackathons, you meet people from all sorts of different backgrounds and different knowledge points and different life experiences in different countries, different states. I mean, from everywhere. And that is what I love about the problem solving at a hackathon, is that you're taking it not from one person's perspective or two people's perspective, but you're looking at that problem from all these different angles, and it means that the solution can encompass so many different more aspects and really completely solve the problem.
So in researching this, we found a study that shows actually an exponential relationship between the frequency of a stethoscope being cleaned and actually the number of deadly bacteria found on the stethoscope diaphragm.
And we built a seizure detection device for use in pediatric epilepsy.
We have designed a revolutionary blanket wrap that combines all of these methods into one. Presenting to you Mamta Blanket Wrap.
First one is the Best Pivot Prize. It's Team Mumta. Team Mumta.